أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته. So this is a presentation from the British Islamic Medical Association, and my name is Fasih. I'm a chest physician presenting this on behalf of British Islamic Medical Association, and I must thank the team who have gone through so much effort to put the slides together. And in this short presentation, I will be talking about the topic that everybody's interested in right now: coronavirus, COVID-2019. And we'll split the presentation into two broad areas. In the first part of the presentation, we will talk about coronavirus and we will talk about what you need to know about it. And in the second presentation, we will cover some of the other things in terms of how you can protect yourself, how you can stop it from spreading, and avoiding panic and so forth. And we'll cover all of those things. So that summarizes what I just mentioned to you. So the first part is about coronavirus itself, and part two is some practical tips, inshallah. So let's get straight into it. What is COVID-19? So COVID-19, as we all know, is a new illness that can affect your lungs and your airways, but it can also affect various other parts of your body. Now, COVID-19 is caused by the coronavirus known as SARS-CoV-2. The coronavirus is a virus we've known about for over 50 years, but the particular strain which originated from Wuhan in China is thought to be the cause of COVID-19. And if you look here on the right-hand side at the symptoms of coronavirus, cold and flu, you can see that the symptoms are very similar. So the typical fever, cough, fatigue, and some of the other symptoms listed there are all present in each of these three conditions, which makes it difficult to know whether you have coronavirus or not. And this is a really important point I must emphasize. Coronavirus has the typical symptoms of cold or flu, but the normal progression of disease and the consequences can be far worse. And it's important at this point to also mention that you can sometimes have very minor symptoms. So the classic fever and cough, whilst it's present in most people, in a small proportion of individuals, they will have very few symptoms, if any at all. And that makes it even more difficult to differentiate and to know when you have it. But broadly, the symptoms are those of a cold with fever, cough, aches and pains, headache, and sometimes shortness of breath as well. And so coronavirus, okay, fine. So this is a condition that can cause these symptoms, but why should we worry? Why the panic? Well, here, this infographic, this image demonstrates this absolutely perfectly. The mataf in the Haram Sharif, as we know it, which normally looks like it does on the right-hand side, currently is as displayed on the left. These are unprecedented times. This is a challenge of a generation, of a lifetime. And whilst I don't wish to scare people in this video, in recording, I want to outline the key points, and we must understand this, and it's incredibly important. So the first question that we get answered is, oh, isn't this just? Well, indeed, the symptoms are like a flu, but as I mentioned, it is very different in terms of how it progresses. So what we know from years and years of data is that on average, about 1 in 1,000 people will die from flu. And what we can see here on the right-hand side are the numbers, and this is updated yesterday, and this keeps changing, so it's updated on the 21st of March. 272,000 individuals have been diagnosed with coronavirus, and just about 5% have unfortunately died from their illness. But actually, if you look at the number next to that, 87,000 have also recovered. So we mustn't be too gloomy, but we must understand the challenge that is ahead. And putting those numbers in comparison, it appears that if you have COVID-19, you are 40 times more likely to die from it than you would if you had the flu. So we must dispel this notion that the coronavirus is just the flu. And as I mentioned at the beginning of the presentation, the symptoms can be incredibly mild. But what's even more concerning is that you can spread the disease even before the onset of symptoms. So somebody could have coronavirus, they could go out and get it from wherever else, whether that's the supermarket, whether that's work, whether that's on the tube. They could then have no symptoms at all for 5 days or sometimes even longer. But in those 5 days, they are spreading it to vulnerable people at home, to family, friends, relatives, and co-workers. And it is incredibly important, therefore, that we take this seriously and we listen to the guidance that's being given to us. What we can also see in the picture on the right is the incubation time. So as we mentioned here, it can be up to 14 days before you develop any symptoms. And without becoming too technical, we also know that the coronavirus is highly infectious and much more infectious than any viral illness that we've known in the last few decades. So why are we worrying right now? Well, if we look at this, this chart, we can see here the yellow line is China. Of course, the big concern right now in the Western world and all across the world is what we're seeing on the news with what's happening in Italy. And Italy there is the black line. But what really concerns us is the UK seems to be following Italy, and actually there are more deaths at the same point 13 days ago, which is how far behind Italy we are. And unless we take this seriously and we listen to the medical professionals, we listen to the advice being given, and we listen to the government, there is a very real risk that things will become very bad and out of control. And I'm going to spend some time in this presentation trying to really get that point across. So the College report, which was published earlier last week, led to a change in the government strategy, a chilling report. And what the Imperial College report did, it did some prediction modelling. So the UK has nearly 70 million people, and it is predicted that between 60 and 80% may get COVID-19. And it's important to mention this is without the control measures that the government and healthcare professionals are recommending, or not just recommending, but instructing. And just under 4.5% will be hospitalized, which is nearly 2.5 million people. Now you may turn around and say, okay, 4.5%, but 95% will be fine. Indeed, on an individual level, most people who get coronavirus will be fine. But look at those numbers, they are staggering. 2.5 million people will be hospitalized. We do not have close to that many beds in the NHS. Prediction modelling from evidence in Italy and China and other places suggests that 250,000 will require intensive care beds. And currently, there are just 5,000 beds in the country. And we must think about this. We must take this seriously. What will happen to these patients? If we have 5,000 beds in intensive care and 750,000 people need a bed, I don't think you need to be a doctor to know, or a healthcare professional to know, that resources will be incredibly stretched and unfortunately will be offered to a select few. That is the reality that we are facing. And this is not to scare people, but this is to understand that the situation is incredibly serious. And if we take the most conservative estimate, the lowest estimate of fatality, we're looking at 500,000 deaths in the UK from COVID-19 alone. Again, staggering numbers. And I implore you, I plead with you, please take these numbers seriously. Because if you think that a bed will be available, however old you are, whether you're 25, whether you're 40, or whether you're 70, then you would be making a very brave prediction. It appears, and we will do everything that we can. The NHS and the government will do everything that they can. But the reality of the situation is preparations behind the scenes are being made. And if I was to share those preparations with you, it would send a shiver down your back. The worry is real. We must be concerned. We must look after our population. We must look after one another. So who is at risk from coronavirus? And the first thing to mention here is everybody's at risk. When this initially began in China, there was this misnomer that only the elderly were being affected. However, what we've seen in Italy is incredibly different. Young people who are young, fit and healthy with no medical problems have unfortunately been dying from the coronavirus. But what these numbers demonstrate is the risk becomes significantly increased in those people that are above the age of 60. And if we look there, people above the age of 70 have a 1 in 8 chance of dying if they get coronavirus, and people above the age of 80 have a 1 in 5 chance of dying from coronavirus. These are staggeringly high numbers, higher than heart attacks, higher than strokes, higher than pneumonias, higher than major surgery. We must understand this is incredibly serious. And those who have other conditions, such as heart disease, diabetes, high blood pressure, are also higher risk than others others who have no health conditions. But again, going back to my point, which I've made a number of times, and there will be repetition, I need to get these points across. Even if you're young, fit and healthy with no medical problems, people are still dying from this condition. So this affects us all. And just to build on that a little bit, there seems to be this notion that if I'm young and if I get it, on the balance of probabilities, I will be fine. And yes, you are absolutely right. On the balance of probabilities, if you were to get coronavirus, you will probably recover, inshallah. You will probably recover from your coronavirus. But remember what I said at the beginning. You will have spread it without knowing. And even if you have the symptoms and you don't take the precautions, you of course will be spreading it to other individuals, and they may not have your immune system, or they may not have the strength, as we say, physiologically, to overcome the virus. And this is why we must take this as a community, and as a community task, to take this very seriously. So let's talk about the Muslim community in a bit more detail. So what appears to be the case is that Muslims are more vulnerable. In our community, we have significantly elderly individuals, and our style of living often involves extended families where you have grandparents, parents, and children. So you sometimes have 3, sometimes 4 generations of individuals living together, fairly tight-knit families, eating together every day around the dining table, spending a lot of time together, and we have a taboo associated with not visiting or spending time with our elderly people. And this, whilst this is amazing, and this is a strength of our culture and our religion, however, in this time, it makes us more vulnerable to the virus, because the virus will spread between those individuals. We also suffer more from diabetes and heart disease and high blood pressure and other medical problems, which have been shown to increase your risk of poor outcomes. And building on the mixing community, we continue to mix in our masajid, in our weddings, in the meat shop, in the supermarket. We are a very social community, and we mix more than many other communities. And this puts us at particularly high risk. So who else is at risk? Well, anybody who's, well, the first thing to say, everybody's at risk, but we're talking about who is at higher risk here. So attending mass gatherings, whether that's your supermarket, whether that's your mosque, whether that's the tube on the way to work, whether that's a wedding, all of these increase the risk of spread. And it's obvious you have lots of people who are very close together, often in confined spaces. Now, we know that the virus spreads in 2 ways, either through respiratory droplets when somebody coughs or sneezes, or through a concept of fomite spread, which is contact spread. If you touch a surface and somebody comes and touches that later, there is a chance they can contract the virus. And remember what I said earlier, you can spread the virus without having any symptoms. So if you're one of those individuals in that gathering shown there, and you have the coronavirus, yet you have no symptoms at all, you think you're fine to go there because you're not causing any damage or risk to others. That's far, far from the truth. You'll be surrounded by people, and if indeed you do have coronavirus, you will be spreading it to them. What about our mosques? Well, our mosques, as sacred and wonderful as they are, and our connection that we have with them, and it hurts us incredibly as healthcare professionals to be saying this, our mosques are the time in need where we turn to. But we must also balance that against the current situation. Mosques are a very unique environment and for the spread of this virus. And disproportionately elderly population attend the masjid. They have close proximity to each other. The ventilation systems aren't as developed as they should be. And again, we talk about the fomite spread. So if somebody touches the carpet, for example, and they have the virus, the next individual comes along, they can expose themselves and really risk themselves, their family and their community. Our wudu areas are also high risk. People share towels, people are washing their mouth and nose, and this is a very, very high risk area. And going back to what I said earlier, as a Muslim community, we are a social community. When we meet one another, we hug each other, we shake hands with each other, we stand around and we have a chat. And these are all amazing things, and we would all be missing these things over the next few months. But right now, we have to understand all of these things increase the risk of spreading the virus, and we must take precautions. And we have to also understand that, and we must be cautious, that an outbreak linked to a masjid or a place of worship can result in significant negative public relations. And so this Daily Mail article, which was published yesterday, if you look at the headline, has coronavirus outbreak that has killed 28 in the West Midlands is linked to church, attended by worshipper who did not realize they were a carrier. And actually, if you read that article, it's only a theory. It may well have been the cause, but it's only a theory. And we have to be very cautious that if our mosques come under the line of the spread of the virus, it does our community absolutely no favors. And whilst we all have good intention to pray to Allah subhanahu wa ta'ala and to fulfill our obligations and to spiritually nourish ourselves, the ulama and those that have given an opinion on this have been quite clear that praying in your house, avoiding the masjid and doing the same things in the house that you would have done in the masjid results in an equal reward. And I know it's difficult for us to accept this as a community. We're not used to this. Certainly in my lifetime, I've never seen anything like this happen before. But unprecedented times call for unprecedented measures. There's also real worry about burial in janazah. So the concern is the NHS will be incredibly stretched. There will be insufficient beds, as we've already discussed, there will be insufficient ITU beds, and the adequate care or normal levels of care will not be provided to individuals. Of course, either as a consequence of that or as a consequence of high-level care and the virus itself, thousands of people are expected to die, hundreds of thousands. And there are very serious risks about janazah and that we need to iron out. Is the body contagious? How do we give ghusl to the deceased? What about the gatherings? When somebody passes away, family members want to be there. Current regulations and guidelines would state that having more than the absolute necessary number of individuals would be high risk to those present. And so therefore, these things sound incredibly scary. And to avoid being in that situation, we must take heed of the advice. And so, just to summarize some of those key points, it is projected that 500,000 people will die in the UK from the virus alone. That does not factor in all those people who will die because the hospitals will be full from coronavirus, so those individuals who have other conditions. That does not factor in the stretching of resources and staffing who won't be able to dedicate their time as much to other patients who will have other illnesses. This is a very, very scary number, and we must take it very seriously. And regardless of what anybody tells you, I take it from me, take it from what's happening in London right now, take it from the government, take it from what's happened in Italy, there will not be enough hospital beds. There will not be enough intensive care beds. there will not be enough ventilators. There will not be enough staff. And very concerningly, if you or a relative or a family member, extended family member, is admitted, God forbid, to hospital, visitors, it is highly likely visitors will not be permitted. And as we've discussed already, Muslims will be disproportionately affected. We are a high risk group. And so we must take this seriously. I think I've made that point very clear. This is a community issue. Whether you're young and you think you can't spread the virus, that is, or you can't die from the virus, that is incorrect. There's nothing to suggest that you're infallible. And remember, you can be spreading the virus to other more vulnerable people in the community. So we must take the advice seriously. We must listen to what the government are asking us to do. We must listen to the healthcare professionals. And inshallah, this will pass. Like every other pandemic, this will pass. But until it does, we have a duty to listen to those who are telling us what we need to do. So I will end the first part of the talk there. And I will leave you with the ayah from the Quran, Surah As-Safat. I'll read out the English. Exalted is your Lord, the Lord of might, above what they describe, and peace upon the messengers, and praise to Allah, Lord of the worlds. We put our trust in Allah, we believe in Allah, we also follow the advice that we're given. We do both. One is insufficient, we must do both. If we move on to part 2, so in this part, I'll be talking a little bit more about what you can do to prevent catching the virus. So some practical tips, what you can do to prevent spreading it, what should you do if you have it, and what should you do to help. And I'll be bringing back some of the points from the first part of the presentation. There's a lot of repetition. I need to repeat points so everybody understands. And I'm sorry if some of this is obvious, but I think repetition is key. So what should I do to prevent catching it? It's the million-dollar question. Everybody wants to know what they can do to prevent catching it. If we look to our religion, a number of the answers are there. So the Messenger of Allah ﷺ said, cleanliness is half the faith. And if we practice cleanliness rigorously, we will significantly reduce our risk of contracting the virus. This is not a doubt, this is certainty. We must practice cleanliness. So what can we do? Let's give some practical tips. Well, the first thing is to wash your hands thoroughly. So the advice is to wash it for at least 20 seconds. And what you can see in this picture in the top left corner is the hand before washing. If you just wash it for 6 seconds, as per the top right picture, the hand is insufficiently clean. You've managed to clean the fingers, but the back of the back of the hand is still dirty. And therefore the advice is to wash for at least 20 seconds. Make sure you wash the front, make sure you wash the back, in between the knuckles, in between any rings, in under the nails, at the tips of the fingers and the thumb, around the fingers and the thumb. And this is really important. So the ideal is to use soap and water, but if they're not available, then hand sanitizer gel is a perfectly acceptable alternative. What else should you do? Well, again, let's turn to our religion. The Prophet ﷺ said, if you hear of an outbreak of plague in a land, do not enter it. But if the plague breaks out in a place while you are in it, do not leave that place. SubhanAllah, here is our answer of what we need to do. Do not enter an area where there is a plague, and if you have it, do not leave that place, i.e. social distancing and isolation. So it is absolutely crucial that as a community, we observe and we practice very strictly social distancing. What does social distancing mean? Well, it means avoiding any public areas, as I discussed, any supermarkets, restaurants and pubs and cafes and things have already been asked to shut. So we don't need to worry about that. Most mosques across the country are also closed. However, that does not mean to say that you can go to gatherings of individuals, whether it's weddings, parties, friends gatherings. This is all a breeding ground for spread of the virus. Stay at home as much as possible, whether you are a vulnerable individual or whether you're not, for the reasons I discussed earlier, and avoid crowds as much as practically possible. If you need to go to the shop to get milk, bread, or whatever else, minimize the time you spend going there and exercise very strict precautions, and we'll talk about some of those. So what kind of precautions can you do? Well, do not touch your eyes, nose, or mouth if your hands are not clean. What we know, so we're still learning about the coronavirus, but what we know is that it spreads through two ways. The first way is through airborne droplets after coughing or sneezing, and somebody can inhale those. How long they remain in the air is still up for debate, and there are studies showing that it can be for a few hours. And the second way it spreads is through contact spread. So if somebody has coronavirus, whether they know it or not, and they touch their mouth or their nose, which we all do repeatedly, it's now on our hands. We touch the door handle when we enter the home. We touch the shopping trolley when we go to the supermarket. We touch the remote control when we want to lie down, relax on the couch. The next person then comes along, touches those same things, and then touches their mouth or nose and gives themselves coronavirus. And therefore, it's really important that we try and break that chain by not touching our eyes, nose, or mouth. If the coronavirus is on your hands, you will not contract it. And of course, it is completely necessary to not have any visitors to your home unless absolutely necessary. And that's whether that's friends, whether that's close family, anybody. What can you do to prevent yourself spreading it? What should I do to prevent spreading it? So, as I mentioned a couple of times, we are still learning about the coronavirus. So, a virus that we've known about for 3 months, and every day, every couple of days, and a whole number of publications come out which inform better. But what we do know so far is that previous viruses, and it appears this virus as well, spread through the two ways that I mentioned, through cough droplets and through contact spread. And so therefore we must take precautions against some of these things. So what precautions can we take against cough? Well, if you have the coronavirus, you're not going to be going out anyway, but even in the house, use a tissue, get rid of it, make sure that you don't touch things unnecessarily. It's very difficult. Keep washing your hands, inform people and ask them to be doing the same. There is no such thing as being overcautious over the next few months while we get on top of things for the reasons I mentioned earlier. It is an obligation, in my opinion, on everybody, not just the elderly and not just community leaders and not just healthcare professionals, but everybody. Every single person has an obligation to do what they can to stop the virus from spreading. So of course, it's particularly important for those who are elderly, that have long-term conditions, whether that's heart disease, kidney problems, liver problems, diabetes, blood pressure, those patients, those women that are pregnant, and those that have a weakened immune system. And the reason is all of those individuals are higher risk, so they must do their absolute best to protect themselves. But to make the point again, this is everybody's responsibility, and we must do everything that we can to stop spreading this virus in our community, in our country, and in our world. You will have heard of this concept of flattening the curve. So what we can see here, the pink curve, is what would happen. So across the bottom, you've got time since first case, and on the y-axis is the daily number of cases. And what you see here is without protective measures, you have a huge surge in cases, which massively overwhelms the healthcare system. There is no way to house these patients in terms of ward beds, there's no intensive care units, there's no staff, and all the things I've already mentioned a couple of times. And the idea is, by isolating, by exercising social distancing, you are flattening the curve. So there will still be people who get the coronavirus, but they'll be significantly fewer. Those people will then be able to make use of NHS resources, because the NHS, whilst it will be stretched, will have enough to provide for everybody. That does not mean to say that everybody will be saved, but a lot more people will be saved from the coronavirus if the NHS is able to provide the healthcare it's renowned for. And we must do our bit to help flatten this curve. So you've been diagnosed with coronavirus. What should I do if I have it? So the key symptom, the key take-home message: if you have symptoms, or if you think you've got it, or if you've been exposed to it, stay at home. Simple. Ends there. Stay at home. Do not expose yourself to anybody. Protect them. Stay at home. Very important to get advice from the right channels. There is a huge amount of information available right now, but the 111 online coronavirus service is incredibly helpful. It's updated regularly and it's in line with national guidelines. And so I would strongly recommend that if you were to be afflicted with coronavirus, even if you think you know what you're doing, go on the 111 website, fill in the questions and get some advice. For those that are unable to access 111's website, you can call 111 and get the same advice. Please, if you think you have symptoms of coronavirus, do not make your own diagnosis. Get help from the experts and let them guide you. And please, please, please follow the advice that they give you, because not only will you save your life, but you will save the lives of many in your community if you will listen. So, okay, so I told you that you need to stay at home. How long do you need to stay at home for? Now, I must mention that this is the current guidelines, and in the next few days, this may change. The 14 days that I'm about to quote may well increase, but the evidence or the information we have so far suggests that this is the best advice. So if you have symptoms, you need to stay at home for 7 days at least, because the idea is after 7 days, you are highly unlikely to be contagious. So you are protected from spreading this virus to others. If you live with somebody, so for example, God forbid, if your spouse, your brother, sister, son, daughter, mother, father, whoever it may be, is diagnosed with coronavirus and you live under the same roof, you will need to stay at home for 14 days. Now, you may ask why. If the person who has coronavirus is only isolated for 7 days, why does the fit, healthy family member have to isolate for 14 days? Well, it comes back to what I mentioned earlier. You can spread coronavirus, and then it can be many days before you develop symptoms. So the person who had coronavirus, say on Monday last week, may not spread it to you until Friday, and you may not develop symptoms until the following Monday or even later. And therefore, by following the advice of staying at home for 14 days, you are significantly reducing your risk and risk to others. What about if you live with somebody who is elderly or has a long-term medical problem or has any of the other categories that we mentioned? So this may be difficult, but try and find somewhere else for them or for you to stay for 14 days, whether that's with another relative, whether that's in a hotel, or whether that's somewhere else. Distance yourself as much as possible. And if you are unable to do that, then within the house, try and keep away from each other as much as possible. And that is very challenging, but don't share bedrooms, don't share living rooms. Try and keep your distance as much as possible, as practically possible. If you have more than one bathroom, separate your bathrooms. Ensure that you don't share towels, whether that's kitchen towels or bathroom towels. Ensure that you don't share crockery and cutlery and anything else where you can be exposed to any droplets. And this is difficult. So it's very challenging, but these are some of the things that you can do, and there's further information available online. And so, as discussed, there's a huge amount of information available. But if you go on the BBC website, if you go on the government's website, and the links are there, if you go on Public Health England's website, and if you go on the 111 NHS website, you will get sound advice which is simplified and is very good advice. If you follow, you will hopefully reduce your risk as much as possible. So we're at a time where everybody wants to help. It's really important. Our community is been afflicted by this virus. What should we do to help one another? So in summary, we need to be informed, we need to be cautious, but at the same time, we need to try and avoid panicking. And it's a difficult balance. So the first point, and again, if we quote a verse from the Quran, to all the messengers we sent before you were simply men to whom we had given the revelation. You people can ask those who have knowledge if you do not know. فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. If you do not know, ask those people of knowledge. And hopefully, through this presentation, we have given you some signpostings to some resources that can help answer your questions. There's a lot of guidance that's been produced, not only from the British Islamic Medical Association, but from other organisations such as the Muslim Council of Britain, the British Board of Scholars and Imams, and other organisations. This guidance is available easily through Beamer channels or through the websites of these organisations. They can be accessed, and please do make yourself familiar with the terms laid out. We must be cautious. So we mustn't spread false information. Believers, if a troublemaker brings you news, check it first in case you wrong others unwittingly and later regret what you have done. There is a huge amount of panic right now, and it is very tempting. As soon as we receive any information, we forward it on, particularly on social media channels. We forward it on to others. We mean well. We want to inform others of what we've been told. But remember, a lot of people don't have the same noble intentions you may have. They want to scaremonger. They want to spread false information. So verify anything that you receive. Question, what's the source? And if you're not sure, or if the source seems not to be credible, then please don't spread that information. And I think this summarizes my whole presentation so beautifully. A man said, "O Messenger of Allah, should I tie my camel and trust in Allah, or should I leave her untied and trust in Allah?" The Prophet, peace be upon him, said, tie her and trust in Allah. We must do both. We must do everything that we can to protect ourselves and others from this virus, and at the same time, we trust in Allah, we believe in Allah's mercy, we turn to Him in prayer, we turn to Him in dua, and we pray and beg Him for His mercy. And very important that we don't panic. If we panic, individuals in our family, other individuals in our community will also see us panicking, and the effects can be quite significant. At a time where people are already struggling, we mustn't panic, whilst we must keep the facts in mind. And so this beautiful verse from Surah Al-Baqarah, and we will surely test you with something of fear and hunger and the loss of wealth and lives and fruits. But give good tidings to the patient who, when disaster strikes them, say, Inna lillahi wa inna ilayhi raji'un. Indeed, Allah, and indeed to Him we will return. Those are the ones upon whom are blessings from their Lord and mercy, and it is those who are the rightly guided. We must remember to continuously turn to Allah and beg Him for help and mercy and forgiveness. This is a significant concern. The Messenger of Allah said, "None of you will believe until you love for your brother what you love for yourself." Subhanallah, we have seen the situation in our supermarkets. We have seen the situation with our own eyes in person. We have seen the situation on TV. Please do not stockpile lots and lots of toilet rolls and hand wash and other food. Subhanallah, you may be protecting yourself for the next few months, but just imagine those individuals, especially the vulnerable, who don't have access or who can't go to the shop first thing in the morning, or may not have somebody to carry all these things for them. Subhanallah, those people are being deprived of these very essential items. So let's look out for one another. Rather than take everything for ourselves, let's serve our neighbours, let's serve our relatives, let's serve the elderly people in our community. And rather buying 40 months worth of toilet rolls, let's buy an extra toilet roll, not for us, but for them. We must remember we are in this together as a community, and we must look after our whole community. So to summarize everything that we've discussed so far, coronavirus is not a typical virus. It is far different from the flu, but the symptoms of coronavirus are the same or very similar to what you get in the flu and the cold. And even doctors are not able to distinguish between the conditions. Everybody is at high risk of a poor outcome, but particularly the elderly and those with medical problems. Muslims are higher risk than the rest of the population because of the medical problems we have in our community, but also because of our culture and the way we live. It is absolutely imperative for me to highlight the NHS will not have resources if people do not follow advice, if people do not undertake social distancing, isolate themselves, and listen to the advice of the professionals. The healthcare system will become overwhelmed. People will die who potentially could have been saved. The NHS will not have resources. It's easy to think we're in a developed country, the NHS, as amazing as it is, will provide for us all. But believe you me, it unfortunately will not have the resources. Gatherings, whether they're weddings, whether they're the mosques, whether they're any other gatherings, will be sources of high transmission, and we must do everything that we can to avoid them as much as possible. We must consult and seek advice from experts, whether that's healthcare professionals, whether that's the government, whether that's the ulama. We must listen to the experts, and we must be proactive and put human life above anything and everything else. The sanctity of life is the most important, and we must remember that in this very difficult and distressing time for us all. And so I leave you with these two messages. So first, from the Quran, exalted is your Lord, the Lord of might, above what they describe. And peace upon the messengers, and praise to Allah, Lord of the worlds. And I urge you to spread the message, not the virus. Assalamu alaikum wa rahmatullah. Thank you for listening. I hope you found that to be beneficial. Look after yourselves, look after your families, look after your community. And remember, this will pass. We had previous pandemics and they passed. This will also, inshallah, pass. But until it does, look after and follow the instruction of the authorities. Assalamu alaikum.